Today we will do a wax-up of maxillary first premolar, and as we see here in the maxillary first premolar from the buccal view, we can see the cervical line here and the mesial concavity in the mesial surface. The contact is broader than the anterior teeth, and it's located more closely than the halfway between the cervical line and the cusp tip. As we see here, it's concave, and the mesial slope it's longer, or mesial cusp ridge is longer than the distal, so the cusp tip will be located more distally. The cervical area here, it's narrower, about 2 millimeters than the widest mesodistal area here, and a short distal slope. If we look at it from the occlusal view, we will see here the central groove and a mesial groove crossing the mesial marginal ridge. It's just lingually to the mesial contact area and extended on the coronal part, and we can see here also the mesial developmental depression on the root. If we look at the tooth from this side, the lingual cusp tip is shorter 1 millimeter than the buccal cusp. From the lingual, it's curved, and the cusp tip is more mesially. The dimension buccolingual is wider than the mesodistal in the premolars. Now we will build up the mesial area of maxillary first premolar. Okay, and as I told you before, it's better for us to mark our cervical line. So we will build part of the root and then a major part of the crown. We can use the wax-up spatula for building the major part, and we add the first layer and then spread it all around. Or we can use the PKT. So while I'm adding, I should make sure that where is the widest area, I should add more, which is near the occlusal. The central groove is exactly in the center, and it's connected with the mesial developmental groove here. I can just mark it. Then I can heat my wax up and blend it together. There are certain areas that I need to add. I just add here at the corner. I need to add more buccal. I'm removing the excess. You can see that the buccal wall has two inclination. It's not straight, so you should, when you do your wax up, you carve here. I'm placing the contact area now. Almost here. And then I blend it with the rest of my wax up. And now I will carve my cervical line. I should clean my instrument, so I will not create the white or the light blue flakes embedded in my wax up. And when I carve the root area, I should pay attention to the mesial concavity. I should follow the depression of the mesial developmental groove. We can use the disc. And with the cleoid, I can carve the rest. and it should be flush with my stone model, not below and not over contour or under contour. I will go again and mark my cervical line. And as we said, the mesial area is concave, so I can use the disc in the clear discoid to remove some of the mesial surface below the contact to create the concavity, and I'm carving in one direction. Carving in one direction, almost smooth here. I'm flush with the stone model. I also created the concavity. And then I'm carving here the mesial depression or the mesial developmental groove. Central groove is continuous with the mesial marginal developmental groove. Then we can use the occlusal for the occlusal anatomy, the anatomical carver. And also it should pass through the groove, the mesial groove. I should clean my wax up either with a brush or with the air. If you have excess on the occlusal surface, you can use the Holland bag to smoothen it. After that, you use the anatomical carver to create the grooves.